Hey folks, welcome to the show. I want to thank you all for joining me here on Let's Be Perfectly Queer. I'm Rogers TV Barry. My name is Jayce Carver. I'm filling in for Randy Davis today, and I know they're going to edit all this out. But I just want to introduce myself to all of you. So today, folks, we have the Couchiching Family Health Team's, North Simcoe Muskoka Trans Health Services. It is a mouthful. It is a mouthful, but welcome to the show, folks. And I want to just start off the show by each one of you introducing yourselves and telling me what role you play with your organization. So, draw straws, whoever would like to go first.
I guess I'll go first. My name is Sarah. My pronouns are she, her, and I am the peer advisor for Trans Health Services.
So I can go next. My name is Jamie. I use he, him pronouns, and I am the mental health therapist on our team.
Nice.
And my name is Laura. I use she, her pronouns, and I'm the nurse practitioner on our team.
Great. So I guess one of the first questions, like we see a lot of family health teams now doing trans health services. It's actually happening a lot in Ontario. I know the community I'm from in Windsor, they've been doing it for a long time. What makes this service better? Because oftentimes when trans health is provided through cisgender identified spaces, there's a lot lacking, and we tend to be pathologized. And what makes this a different situation, and why should people come see you all? And whoever wants to field the questions, you might all have different perspectives. So I'd like to hear from you all.
Mm-hmm. Sarah, do you want to speak first?
I guess so. We're different from other services because we offer, I think, a more robust line of services, I guess, for our clients. A lot of family health teams probably don't have a peer advisor to help folks navigate some of the more challenging aspects of socially transitioning. So doing some of that paperwork and even taking some of the earlier steps of transition. So someone like myself can help a client shop for clothing for the first time. So if they don't have some of those supports to, go with them to the store to shop for their clothing they need, especially early stages, I can be that person that goes there. If somebody has questions about some of the elements of a transition, maybe it's my experience with surgery or my experience with coming out, I can share some of my trials and tribulations around some of those topics and hopefully offer some insight to those as well.
Mm-hmm. Yeah, I think to piggyback off what Sarah said, one of the things that makes our service different is that both Sarah and I are trans ourselves. So we're really coming at it from that perspective of bringing our lived experience to the table. Mm-hmm. And I find sort of for myself as a therapist working with trans clients for several years, that makes a big difference for the people that I work with to have someone who has a similar lived experience to them, that they tell me they feel much more sort of comfortable talking about it. And there's just a better sense of understanding and openness. And I think that is unfortunately not something that we have enough of as trans identified providers.
Right.
Mm-hmm.
Right. Mm-hmm. It is actually a struggle to find that. My background is I had founded the first trans center in Canada. I was saying that to Sarah and used to travel to do trans inclusive healthcare workshops across the province. And what I always found is that, first of all, in mainstream service provision, trans people are often discounted, or you can't find, even though 70% of our population has post-secondary education, many individuals are still not comfortable going into the work environment because we've been often abused or taken advantage of in work environments. And so it is great to see trans identified people moving into positions where they could really affect change for future generations. So well done. And Laura, it's the same question for you. Why is this different?
Yeah. So what I was going to add on to that is we try to use what's called an informed consent model. So this whole idea of the pathology around trans and non-binary folk, we've been working very hard to have that go out the window. So This is very much, in my first appointment with clients, I tell them all the time, you have nothing to prove. There's no tick boxes. There's no check boxes. I want to get to know you so I know what your goals are.
Right.
But I just take you for face value. If you're telling me this is who I am, this is what I think I need to feel good in my body, I just believe you. So I try to come at it from that perspective and try to give a very individualized approach so that we meet the individual's goals, because everyone wants a little bit of a different thing. And I think coming at it from a lens of everyone's just people trying to be their best selves. There's no pathology here. Nothing's wrong with anyone.
Right, because our journeys are so medicalized, right, and that makes trans folks feel like they have to engage in a medical process in order to exist. And I think that even in the trans community, and if you two folks would like to chime in, I think that there's even layers of oppression within our own community that say if you haven't had this surgery, you really, and especially with older generations of trans folk, that you don't qualify for some reason, right? So how do you go about working with individuals to make sure that they understand that this is an individualized journey? Like, I know you provide therapy, so you're probably adding something around that in your therapy.
Mm-hmm. Yeah, I mean, so I think for myself, I talk a lot about this with clients, just this gatekeeping that happens with our community around who is trans, who isn't, quote unquote, isn't trans or not really trans. And how really that all stems from sort of the same place of this like cis-sexist, heterosexist, patriarchal, colonial, white supremacist society. And I know it's a mouthful, but I spend a lot of time actually talking about that with clients, that, you know, these beliefs that we learned about the gender binary are not natural and innate in humans, that there are, you know, they really come from this very specific place that's related to colonization. And that they, you know, that we don't have to buy into that.
Yeah. And I think to that end, just so that everyone's kind of clear, Jaime sees a lot of our clients, but Jaime doesn't have to see everybody. So we don't assume that because you're trans or non-binary or gender variant, that you have something that needs to be worked on mental health wise. If you do, fantastic. Let's link you up. Let's find you the resources. But there's no assumption that that's the case. There are a lot of people who are functioning fantastically in their lives and just are looking for something specific. And that first appointment with me, I also always focus on the fact that there is no right way to do this. So we've got a lot of clients who, you know, you don't have to have, if you don't need surgery, don't get surgery. If you don't need hormone therapy, don't go on hormone therapy. If you want it for a little while, want to come off, that's fine. This is very much a choose what fits your life best approach.
Pick your adventure.
Yeah, choose your adventure.
When I started my transition, I'm just going to share a little bit about myself. When I started my transition in 2012, there was still a lot of like, you have to go through Canadian, what is it, CMHA?
CMH.
CAMH.
CAMH. You have to go through CAMH. You have to qualify. You have to live in that gender identity for a certain amount of time. And I went and saw a psychiatrist. I was misdiagnosed with bipolar disorder because they told me trans people didn't exist. And that led to me taking like a lot of medication that became addicted to. And that's the system that has oppressed and let us down for so long. So it's refreshing to hear that individuals can come in and they already exist. Because I still remember my first endo appointment where he said, I see you, you already exist. Let's get you there. And I remember that feeling of being noticed by someone who can make a change in my life. And that sounds like you folks are trying to build a team that sees people, right?
Absolutely.
I'm really impressed by what Sarah said around being able to actually leave the space where you are doing work in a health center and go into community and work with individuals on individualized goals that they have and areas where they might need some support. And that's the model I used when I founded the organization. It was, you were always linked with a peer supporter, and then you could have a counselor or a healthcare provider as well. But the peer supporter was like your first real point of contact. So the first person was person with lived experience, and that we didn't put our own opinion of transition on a person. We helped them to set goals of what transition could look like. Can you talk a little bit more about that piece so that your potential future clients can hear what they could expect?
Typically, that's actually how our whole program works. If somebody doesn't have a clear goal going into our program, they typically come to me. And we have a conversation. I learn a little bit about their story. I share some of my own just to get folks feeling a little comfortable with that element of sharing. And then from that point on, we come up with their goals and what they want to do. In terms of the community, I think every one of us realizes that poverty sometimes goes hand in hand with the trans community. You know, some folks don't have access to cars or travel, especially in more rural spaces, and you can't access buses and all that stuff. So we try to go to the client. So if that means, we travel to another family health team that we've partnered with within that North Simcoe Muskoka region, like boundary, we'll do that. In terms of myself, I guess I am the most unique in the sense that I don't have to work within the confines of that office space. So as I said, I can go out and meet clients to help them shop, especially initially. Sometimes they need to just get out as themselves. They could be a little bit farther along in that transition process, but not quite comfortable in going out as themselves. If that means we meet up in a public place, have a coffee, go for a walk, whatever it is, I sort of work with that client to help them socialize, get comfortable as themselves, because it's kind of frightening and scary. Initially speaking.
Yeah. Oh yeah.
Yeah, 100%.
Clothes shopping for the first time, terrifying.
Oh my gosh, I remember being fitted for my first bra. Oh my God, what an and you know what? It's that time where people don't want to touch you either, right? It's like they're afraid they're going to catch something from, they're going to catch the trans disease or something,
The trans cooties.
Yeah.
Thankfully, we do have some really good providers that are quite good with the trans community, are quite comfortable, especially like around clothes and fitting. Certain stores sort of have welcomed trans folks, like Pennington's for the larger woman has been pretty good for the trans community as well, at least in my experience as somebody shopping for bigger clothes.
And I feel like we have to, and I don't know where to do this, but I know I was just trying to find Shanna, who's our administrator, is the first point of contact. And she isn't with us today, but she's an integral part of this team. She really is the fourth.
I spoke with her on the phone, actually.
Yes. She's really the fourth face. She's the fourth face of this call that's not here right now. So just so that everyone kind of knows what the process looks like, so that they know how to access this team if they need it. We are largely self-referral. I think Shannon told us today 90% of our new referrals this quarter have been self-referrals. So if you are within the North Simcoe Muskoka region, we are regional.
Now, what is that region? Because I'm not from here. I just moved here, right? So what does that region look like?
It's big. It's big, and its boundaries are annoyingly jig-jaggy. But we cover up to Gravenhurst, Bracebridge on the north end.
I think as far as Huntsville, actually.
Yeah. And we have
Barrie,
Aurelia, Collingwood, Wasaga, Innisfil, anywhere in between those. Yeah.
Are you partnered with any queer and trans organizations or AIDS support organizations in those regions in order to create a referral base?
So Sarah kind of has all I don't know if she over here in my screen, has all of she's our contact person with a bunch of organizations.
There's a Sarah
Shanna as well.
There's a Sarah in there too?
Our Sarah right here, Sarah Crawford, the peer navigator.
Oh, right there. Okay, so she's up here for me. Sorry, not a computer lady. All right, hi. So Sarah, okay, so because I work now at the Gilbert Center, right? So this is a good connection to make for individuals who come in for support.
Yeah. That's another element of my role is I do try to find those community partners or those organizations that we would consider trans positive or trans friendly. And then I can direct clients to those services, educate them on what kind of services a particular organization has. And I try to, when we develop programming or groups, we do try to engage some of those community partners, have them send in a volunteer to come in and talk about those experiences with our community, just so that they can get, I guess, a point of contact or a point of reference in the future, so that, maybe they can feel confident enough to reach out and access some of those services.
So what about, for those who transportation is an issue to get to your office? I know, Sarah, you can go out, but is there telehealth opportunities for those who have transportation insecurities?
Yeah, so two parts to that. I think right now, a lot of us are still doing some form of virtual care. So I would say 80% of the people I talk to, I'm either doing phone or virtual, and we are slowly building some more in-person appointments. For clients who aren't able to get in to see me in person in Aurelia, we offer touchdown spots. We have some partnerships with other organizations that let me use their space. So prior to COVID, the NP that was in my role before me actually had set days of the month where she went to Barrie Family Health Team, where she went to the Georgian, I think it's the Georgian Bay Family Health Team, up in Huntsville as well, the Cottage Country Family Health Team. So she had some touchdown spots once a month where she went and actually was able to see clients who are from those areas in person. So that's kind of the goal to get back to.
Yep.
As that's for the health. Now for the mental health. Let's talk about.
Yeah. So my hope is I've only been in this role post-COVID, so I haven't had the opportunity to get to travel around, but that is certainly one of my goals that I would like to be able to do. I'm technically employed by CMHA, so the nice thing about that is CMHA has offices in all of those areas where I could likely borrow some space. However many days a month is kind of appropriate based on my client load in any given area. So that would certainly be my hope. I'm a big believer in being in community when possible. I've also, honestly, in my previous role where I was a very community-based person, I used to do sessions with people. Sometimes we'd go for a walk, we'd sit in a coffee shop, just to make it a bit more accessible. And so my hope, post-COVID, when things open up again, is I'd love to be able to do that with people.
And I'd like to ask a little bit more about your style of therapy, because many of us have experienced trauma. Mm-hmm. So if you Google me, you'll see that I was almost murdered in September. That's kind of why I left the organization and moved myself out here to try to start again. So many of us have faced these kind of tragedies in our life. So what is the background around trauma that you bring along with you? Do you do EDMR? Like what form of therapy are you providing for individuals?
Yeah, excellent question. I'm glad you asked. Trauma is I would say probably the biggest part of the work that I do. I don't do EMDR. I'm being trained currently in a modality called somatic experiencing, which is a body-focused trauma therapy based on sort of working with how trauma is held in our body when we go through sort of threatening experiences or overwhelming experiences. And so I do a lot of work with the folks that I support around managing that, learning how to sort of move through that and be able to find more moments where you feel settled, connected, and able to be present in the moment. And so that is, I'm going to borrow a quote from a friend who once joked, the DSM is just a big book of trauma. And I really believe that and find that to be true in the work that I do. The longer I work in this field, the more I find that the things that present as like simple anxiety or depression or emotion dysregulation all end up coming back to trauma. And so I do a lot of that work with my folks that I am privileged to serve.
Great. A few more questions around just accountability to the community. Mm-hmm. And so is there a board that governs the work that you do, and what is the trans representation on that board to make sure that there's people in leadership that have lived experience that make these decisions?
Okay. So
I'm putting that out there to y'all.
Yeah.
So I know that it's probably a better question for the administrator of the program, but she's not here with us.
We have info.
Yeah, I'm going to look to Sarah for this.
I did warn her I was asking this question.
So our program came to be. There's a steering committee, so there's a lot of community representation on that, as well as representatives from Soldiers Memorial Hospital, the family health team. I think all three of us are on that team now as well. And they sort of would meet every couple of months and sort of set a direction or a goal for the program. I think we do it.
I want to say it's quarterly. Does quarterly sound right?
Now.
I think it's quarterly.
Yeah. So now we're meeting quarterly now that things have sort of taken off and we are expanding, and we seem to be. So we're sort of accountable to not just the board, but I guess the community as well, because if we're not doing good work, they're going to, the community tends to hear about that stuff, right?
100%.
And yeah.
I think
the
a
whole
lot
point
of
is to reach folks, right? To reach folks,
Yeah.
make them feel confident in the services that they're going to get, and make sure that they feel like they have a voice in their own service delivery, right? So, and that's kind of where my question was formed out of is, how empowered do we make trans individuals in the decision making around service delivery? Yeah, so I think you kind of answered that question. Does anybody else?
I was going to add on to that a little bit. We do offer, Sarah's been pretty fantastic in creating some programs that we've done gender journeys for adults. We're doing gender journeys for youth right now. There's a group called Transmit, which is more of a, what's it stand for?
Trans Monthly Inspirational Talks.
So all of these programs that Sarah has created and that we run have the opportunity for feedback, and we are very, very big on, can we talk about what you need? What are we not providing? How can we do this differently? I don't think any of us want to be doing a bad job. So
no, of course
making sure that we are hearing the voices that are telling us what they need and catering to that is very high on the priority list.
I'm definitely going to be wanting to invite you folks back for more interviews in the future, maybe even really around the part you play with the organization, and make sure that people know how to get connected, right? So I think on an individual basis, why do you want to do this work? On a personal basis, what brought you to this work? Why do you stay in this work? Because we all know that working with people, first of all, no one's getting rich doing this work. Never get rich doing this work. And you have to love it, right? And I used to say that to the people who I brought in to help me form my organization. I used to say, you have to love this as much as I do, because it's really about a labor of love, getting something started that didn't exist before. So why for you is this where you want to be in your life right now?
I guess I'll go first. For me, I grew up in rural religious areas. I'm also, I think, the oldest member on the team, possibly. So I came from a time where I also struggled to access care. I was the one almost guiding the medical professionals that I was seeing through that process. Like, we were both learning at the same time. So, I mean, that's part and parcel why I stepped into this type of work, because there is such a need for these types of services. And I also, as part of my journey, had many struggles, and, peer supports were integral to me, I guess, finding myself and being the person I am today. So I am.
Yeah. I can speak to that next. So for me, I think, I'm glad you asked this question. This is a great question, because I agree. I really think it has to be a labor of love. And for me, it sounds really corny. This just feels like the work I was kind of called to do. And I think, one, it kind of comes out of a lot of my own lived experiences of struggling with my mental health and with my gender, and not really having the support that I needed. So wanting to be able to offer that to others. Also because I've seen the transformative power of community in my life, and wanting to be able to support people to connect to that. And to be part of that, there is just something that feels so different for me, I find, when I'm working with other community members versus working just I've worked general mental health roles, and it doesn't feel the same. When I do this work, I feel just so honored to get to sit with the people that I get to sit with, and to support them and be part of their journey and their healing process. And so, I find in this role and doing this work, I'm just continually just inspired. And sometimes the work is hard, and there's a lot of it, but I love coming to work every day, and I wouldn't want to do anything else.
And to bounce off of that, my background, I used to be a bedside, like a pediatric nurse at Sick Kids. And I was on medicine floor. There was a lot of youth that were coming in that were struggling with their mental health, that were somewhere gender variant, gender fluid, transgender, who were not being well supported in their homes, and ended up hospitalized due to self-harm. So I came at it I saw this role while I was on a mat leave from Sick Kids, and thought, oh my goodness, an opportunity to do something before that, like upstream, to not get to a situation where we're seeing people in such dire straits. So I'm just hopeful that it eventually makes a difference, that we're doing something that can help alleviate some distress in a community that's been marginalized and treated poorly by the medical system for a long time. And that's kind of where I come from. So similar to Jaime, feel very honored that I'm the minority in the group of being the cis representative. And I'm so happy to have both of them to tell me when I'm wrong or when I'm doing something that maybe isn't perfectly in line with what we should be doing. And it's just a great opportunity. And I think we're doing good work.
Well, and when you said that, what a change and shift in the world where trans people feel empowered enough to tell a cisgender white lady, no offense,
a
cisgender white lady when they're wrong, especially a medical provider, right? I can remember shutting my mouth for a long time because out of fear that they would take away what I already was able to get, right? And actually, the reason why I do this work is because of how poorly I was treated throughout transition and having to recover from addiction on top of recover from the trauma that society just hands us and the healthcare sector has handed us. I wanted to create change. And I think that's what we're all doing here is we're creating change, we're empowering individuals, and we're saying we see you. And that's so important. So I think we're out of time, but I want to thank you all, like Sarah, Jaime, and Laura for joining me on this episode of Let's Be Perfectly Queer. And I hope to be seeing you all soon. Actually, I think there's a referral. I made a self-referral to the program. So I called like yesterday or the day before. So I think, Laura, you're going to be making some prescriptions for me. And I'll see you all very, very soon. Yeah. So I'll be doing another interview after getting support through the organization. And
there you go.
So there'll be a first-hand account of what services are actually like, right? And,
beautiful.
But I realize, and I think Jaime and Sarah, this is actually another question. I think we walk through life a little bit more privileged than an average trans person out on the street because we are connected and we have voices within the change-making communities, right? And so I think that we have to be aware, we have to say that on episodes like this, that yes, we understand we have privilege. But we still see you and you are valid. I think that we would be remiss to not say that during this episode particularly.
Yeah, I think the whole team is it's beautiful because we all have that community-centered approach, and everything we do and all the programs we develop sort of focus on that community-centered approach and making sure that we're meeting their needs.
Yeah, because there's layers of intersectionality and oppression, right? Yeah. Let's look at Indigenous folks who are also identifying, or people who struggle with substance use who are also identifying. And I'm sure that you have services that will meet those individuals too. And that's why we definitely need to have another episode to talk a little bit more about other services that you provide within the health team and how easy it is to get referrals in and out of the trans program, right? So again, thank you all for being here.
Thank you for having us.
Thank you for having us.
Yep, thank you.
All right, we'll chat soon.